Once thought as the result of faulty parenting, autism is a developmental disorder that is defined by specific behaviors and may be a combination of genetic, environmental, and epigenetic factors. The many faces of autism. The doctors are on call tonight. Funding for On Call is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, Regional Health, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
Good evening and welcome to On Call Television. April is Autism Awareness Month, and tonight we devote our show to understanding autism spectrum disorder a little bit better. Research tells us that there is no such thing as a typical case of autism. As we discuss autism tonight, we hope that you will understand that we're generalizing in order to give you a picture of the disorder. By the end of the hour, we hope that you will understand that there is still much to learn about autism spectrum disorder, that every person in or outside the spectrum has a value, and that it is everyone's job to seek knowledge so that we can treat all people with respect. You, our home audience, are also a participant in our discussion. Please call in your questions about autism. Call 1-888-376-6225. You can also email them to questions@oncalltelevision.com or oncalltelevision.com and push the red button. We are privileged tonight to have two experts in the field of child development to help us unravel some of the information about people with autism. Dr. Jerome Blake is a pediatrician who specialized in developmental pediatrics. He did his medical training at the University of Texas Medical School at Houston, Texas, his residency at the University of Texas Health Science Center, and his fellowship at the Children's Hospital in Boston. He currently practices at Sanford Children's Specialty Clinic. Eric Kurtz, PhD, is the director of the Autism Spectrum Disorders Program at the University of South Dakota. He leads the ASD Autism Spectrum Disorder Diagnostic Team, providing clinical training and technical assistance, and oversees all aspects of our program. Dr. Kurtz also holds an appointment of Assistant Professor of Pediatrics within the Sanford School of Medicine at the University of South Dakota. His graduate degrees in psychology are from the University of South Dakota. Welcome, gentlemen.
Thank you. It's good to be here.
So, originally from North Dakota, Jerry.
I'm from Fargo, yes.
Yeah, and Eric, you're originally from Sioux Falls. Tell me a bit about your job. Does it just include autism? Does it spread out to all sorts of other areas of psychology?
It does. You know, we tend to focus a lot of our attention on autism spectrum disorders, but when you talk about autism, you also have to deal with a whole range of other coexisting conditions and emotional and behavioral conditions and other developmental disabilities. So we are pretty broad and diverse in our focus and in the kids that we see.
And of course, you're hand in hand with Jerry as far as what he's involved with. And what brought you into this field? I know I met you when you were just a pediatrician. And then you went on to do a specialty in Boston? Is that how that went?
Yeah, I did. I was a pediatrician for 9 years. And I was seeking a better lifestyle. You probably know it, but that's like, the call is not bad, and even though I'm on call, it's the call is not bad as a developmental behavioral pediatrician, where it was pretty busy when I was a general pediatrician.
Is it as busy nowadays for the pediatricians as it was then?
Oh, they have it really
They've
easy.
got it easy, don't they?
They really do. I left at the wrong time.
Yeah. But you went into developmental behavioral issues for peds.
Right.
And about how much of the time that you spend in your practices with autism?
I'd probably say about half of the time, maybe now. Before, I would see a lot more kids that had learning disabilities and attention deficit disorder, and I have partners now, and so we all kind of split up. But I work with the younger kids, and when you work with younger kids, that's when children with autism usually present at younger ages, and so then probably about half my practice is dealing with children with autism.
Yeah. Let's talk a little bit about what it really is. Let's define autism. Eric, how would you say? They say it's a triad. There's 3 parts to it. Is that the right way?
Yeah. Well, you know, first of all, it is a neurodevelopmental disability. It's got a neurologic basis for
In other words, there's something happening with the brain. It's just not a behavioral thing.
Absolutely.
There's some transmitter that's not working right.
There's a whole host of structural and chemical differences of the brain that are different in individuals that have autism in comparison to other people. And what it does is it really just changes the way that individuals interact and respond to their environment. And so everything from social interaction to communication, both verbal and nonverbal ways that we communicate are problematic for individuals with autism. And then you add in some of the other behavioral issues that are kind of non-functional at best and maybe maladaptive, you know, in other cases as repetitive and stereotype types of interests and behaviors.
So can't communicate quite like they should. So they have, the first sign is oftentimes speech. They develop, they can't talk as early as they should.
Sometimes, yeah. Sometimes kids will have the delay in their speech and language, and other times kids will actually have intact language skills. So it can kind of baffle people, you know, in the beginning as they see these kids with different abilities.
I think the speech development is always abnormal. You know, if you think about how a normal child develops, their first words are usually social. You know, mama, dada, hi, bye. Yeah. You know, those are all what we call pragmatic language. Children with autism don't develop language that way. They often will perseverate on a cartoon, and instead of saying one word, you know, at a year of age, 2 words at 2 years of age, they're speaking, you know, at 18 months, 2 years of age with 3 or 4 word sentences, but they're scripted speech. It's something they've memorized from either their videos or they've watched cartoons over and over and they've memorized certain things. Well, a lot of kids will come in and they'll give direct quotes from you know, some of the cartoons, some of the Disney movies, Pixar movies, and then they'll actually even animate it out or act it out, and often in the same pitch and things like that too.
The movie.
Yeah, that makes me have to keep up on the Disney movies. You know?
Yeah, got to go to those Disney movies.
That's right.
So you said communication is one, the speech. The second is ability to empathize or to communicate, or not so much communicate, but to have compassion for another.
Well, they can be very compassionate. Just the socialization, the ability to understand and interpret social interaction, that reciprocity that, you know, when I sit down and have a conversation with somebody, it's not just me talking about my interests, it's me sharing and then you sharing, and it's this give and take.
Right.
And you know, that's part of the problem with the way that when we think about autism as this triad of deficits, it's not specific enough, and actually socialization and communication are really hard to separate.
Yeah, that's when I was reading about it this week, getting ready for this, that was it. Mm-hmm. Aren't they the same thing?
They kind of are. They kind of are sort of a messy little construct that requires each area to be there in order for that to go okay. So
if you don't care to be social, you don't really need to communicate.
True.
I mean, that's what's so hard, I think, with the therapists that work with kids with autism, is they're trying to get them to talk, but where these kids are kind of looking off here and they can't get their attention to focus on them, and they don't really have the need to be able to communicate. So they really have to work. It really requires an intensity of therapy that a lot of other disabilities don't require. You know?
And then there was this third component of repetitive kind of flopping or head movement or twirling or dancing or whatever. Explain that.
Well, it can be motor mannerisms like you described, so rocking or biting or picking or hitting. It can also just be interests or preoccupations. It can be non-functional routines, things that are so pervasive in their life that it actually consumes them a lot of times and actually takes away from their ability to function in other areas.
Example.
So an example might be an individual that maybe is high functioning and loves to read. And so they may just read everything and anything all hours a day if you let them. So a lot of people will come across that and say, you know, that's actually a healthy, kids should read. But this child will read and read and read and read, won't socialize, won't interact, isn't engaged in other adaptive activities, you know, taking care of themselves and all the things that a normal, typically developing child would do. And so it can be something as you know, basic as reading, or it can be other things.
Video games?
Well, yeah. I mean,
I've heard that video games blamed for some of this. Yes, no?
These kids, they're really obsessed with screens, you know, whether it's computer screens, TV screens, or video games. And it's kind of interesting because if you have I often find myself between the kids and the screen behind me, and I'm trying to stand in front of them, trying to get their attention, and they're always putting their head around because you know, that screen is much sexier to them than I am. You know, so and
I don't know how sexy you are, but sorry.
The minute I said that word, I thought
you know, but it's perfect though. Still, they're not interested in a face. They're interested in an object. That's what I've heard. Right. How about playing with toys and wheels and trucks and that kind of a thing? Is that okay with them?
Some.
Yeah. Oftentimes the younger kids, though, don't use the toy for the way it was meant. You know, they don't run, you know, and they'll often sit there, turn the toy over and spin the wheels, and they just are fascinated with how the wheels spin, you know, instead of, you know, moving the truck here and there. And
making a story.
And making the car noises and the truck noises and things like that, like most kids do.
So, I mean, now when I was an intern, no, actually I was a senior med student, 1974, and I was at Eggleston Hospital in Atlanta, Georgia, doing a rotation in peds because I really enjoyed peds a lot. Thought I was going to do it. And we had a little girl who did twirling. She just twirled and twirled and twirled, and it was a clue to this new diagnosis that they weren't sure what it was going on about, and it was called autism. And they called it schizophrenia in children at the time. That's not true.
No.
And but that's the state of evolution. It's evolved. Tell me a little bit about how it started and how it's evolved.
Go ahead, Eric.
Yeah, Eric.
Well, you know, at first it was kind of looked at as something that looked like other things, you know, and it was described in behavioral features, and so for many years it was considered a behavioral disorder. And as things have evolved over time, and we've got new ways of gathering information and new evidence that shows us, you know, some of the reasons that we're seeing some of these behaviors in kids, and it's a neurologic basis. Now, where that comes from is sort of that's the big question right now. There's a lot of research that's showing some genetic links. There's some research that's suggesting some environmental links, and I think that we're just at the cusp of some of that research that's beginning to tell the story as to
why it's occurring.
Absolutely.
And how it's. But it did evolve. I mean, the words started. I mean, it's in the 40s where they first started calling it. And it's evolved into a thing, and it's more than just that one disorder we're describing. There's also a spectrum, a variety of other things.
Dr. Bueller was one of the first psychiatrists in this country, and he coined the term autism, and it's, I think, comes from the Greek that stands for self. And he thought it was childhood schizophrenia. That's what he thought it was. And then Dr. Leo Kanner, who described it more fully in 1943, said that it was not. It was very different from schizophrenia, that this was a developmental disorder as well as a behavioral disorder, and so it was very different.
All right. Well, recently South Dakota State University hosted a conference on autism. We visited with one of the main presenters about the current state of autism treatment.
Well, basically what we see are children who have severe deficits in 3 major areas of development. So it's the communication, socialization, and then behavior. And so when those 3 pieces all are not working right, we have a child who has a significant deficit that affects their entire life. And it is across the lifespan. It's not a progressive disorder, but it will stay with the child. Currently, there's no cure. We now know that it's a brain-based, and we know that it's something in the brain. And when you look at the people who do the brain imaging, we'll see different areas light up in the brain in typically developing people as opposed to people with autism. So we do know that much. We do also know that it's a combination of some genetic predisposition combined with something in the environment. But what those are, we still are not, there's still not a lot of information on that. So you're looking for this set of criteria, and I may see it differently than you. It may not happen when I evaluate the child. So again, it's hard because there is no medical test for it. So you have to really see what you need to see when you're with the child in order to get that diagnosis. And I see the most severe children, and that's not the commonplace. Severe behavior disorders, lack of communication. By the time they get to children's care, public schools have not been able to do what they need to do. But most of the children, you're going to see that they need speech pathology, that they need someone working with them on a way to communicate, that they need someone working with them on better social skills, and they do very well within the general public school system with some supports. Typical children learn from imitation and observation. Children with autism have to be taught every little skill. They don't pick it up because of the social issues. They don't just they don't imitate other children. So we actually have to teach them to imitate. When you work and work and work, and you may have one child that just takes off, and pretty soon they're in a regular kindergarten class, and then you may have another child that it's just not happening with them, and you're doing exactly the same thing, but it's just that the severity of their autism is such that it's just not responding. But I mean, you think about what would that child be if we hadn't have done that intensive intervention. You don't know, so you always want to do it. Some kids will be with us and their school districts just don't have the resources to be able to work with a child that severe. And then we've gotten children in and completely changed their behavior around, and they've then moved back home and back to their public school, which parents never thought that they could do that. And school districts really never thought that they could do it. But it's the training piece. If the school district can then carry over what we've taught and the way that we've taught it, then they're very successful as well. If we can get a child into children's care and get them back to their family and their public school, that is the ultimate goal. In a regular classroom with some supports, and if we can train school districts to do that, we consider that a huge success.
Please call in your questions and comments about tonight's topic. Call 1-888-376-6225, or you could email them on to questions@oncalltelevision.com. We do need your questions. You make this show better, so give us your calls, please. She really gave me hope. I mean, I sensed more hope from what she said than what I've been reading, that there are new treatments, and I want to get into treatments. But let's talk a little bit more about what could be risk factors for this condition. Do we have a clue that there's some things that might be predictors, Jerry?
Well, we know that it is genetic, and that it does run into families. In fact, they're doing prospective studies on a family that has one child with autism. If they're following their other children very closely from at every 3 to 6 month intervals from 6 months on, to study it. How does it evolve? You know, and so those are some of the exciting research studies that they're doing. I would say that the most exciting thing about autism is identifying those kids early and treating them early, and many of those kids do so much better than we ever imagined they would do. You know, I think the stereotype is that this is a severe disability. It's not. I mean, most of the kids that I work with anyway, and most of the, well, I can't speak for you, Eric, but most of the kids I work with make significant progress over time. And they do it if the parents can learn about the disorder and they can advocate through the schools to get the appropriate services.
Yeah, right. But not everybody does well. I mean, there's the spectrum of very disabled, mentally disabled kids, and then there's this Rett syndrome, which is also in that category, right? Rett being something where a child will grow and look normal and normal and normal, and then suddenly deteriorate and turn disabled. Can you explain that a little bit?
Well, Rett is something that, you know, for many years people have been really saying that shouldn't be part of the autism spectrum. And actually, in the next couple of months here, when the diagnostic and statistical manual is revised, that's going to be sort of a, yeah, it won't be considered
bumped
autism
out of
spectrum.
autism.
But it's okay. But
what is it?
What that is that's a genetic disorder, and what that is where, you know, we'll see kids that sometimes seemingly will be typically developing for a period of time, whether it's 12, 18, 24 months, but then rapidly lose skills across the board, lose language. These are kids that might be speaking in a couple of words. They maybe said mama, dada, ball more, and then they're not speaking anymore. You tend to have a lot of other physical problems, low muscle tone, lack of self-care as they get older, just
and
cognitive
the
skills.
Do they just keep going down?
Prognosis is usually not the greatest for those kids. They tend to need very high levels of need for support throughout the lifespan.
The thing that's interesting about Rett syndrome is that it occurs predominantly, not 100%, but predominantly in girls. The reason for that is that it's lethal in boys. Boys don't go through a pregnancy; they miscarry, you know, and that's why it's on the X chromosome, and so it's on an area of the X chromosome that is not compatible with survival if you're a boy. Boys only have one X chromosome,
right.
So whereas girls have two, and so they
can work on the other one.
Right.
Not have to depend on the bad one.
But it still, even in a girl, it causes pretty severe disabilities, often associated with seizures, developmental delays, and then there's a deterioration. They usually become more spastic over time and lose motor function. You know.
So let's just put Rett syndrome over here, and let's go back to autism. That, on the other hand, occurs predominantly in boys. I mean, isn't it like 4 to 15 to 1?
Yeah, well, it's about, you know, depending on the study, boys are about 4 to 5 times more likely than girls to develop the disorder, and so that's something I think is also common in other types of disorders such as ADHD, other types of externalizing behavioral problems, oppositional defiant disorder. Those disorders we see at about the same rates. When you break it down with males and females, you see boys exhibiting those disabilities much more frequently than girls.
Oppositional defiant syndrome, it sounds like my childhood. No, I mean, but so now we're talking predominantly boys. Doesn't that just scream this is genetics rather than it could be environment? I mean, it isn't.
Well, I think one of the things that we learned back in the 70s when they really began to start to do meaningful research, I think, on autism, was they did twin studies. You know, they studied identical twins and compared them to same-sex fraternal twins, and they found, lo and behold, that identical twins, if one identical twin had autism about 85 to 90% of the time, the other identical twin had autism. So that's how they kind of knew, whereas that genetics were involved. Yeah, but even between identical twins, there were differences. You know, that they weren't exactly the same, and that's why I think the term spectrum is really an important advance, I think, in the study of autism, because it is such a wide spectrum.
So there's this huge, what do you call it, probably misunderstanding about, or a fear that vaccinations causes autism. What's the truth of that? I mean, you know, let's not cover anything up. What is the absolute truth? Because that's what we want to know. We want to know, is there a danger with vaccinations? Is there something in vaccinations that could endanger our children? And why would everybody think that this could be caused by vaccinations? And then suddenly they're saying it isn't. So what's the story there?
It's not caused by vaccinations. We have extensive studies of vaccinations, and I think a lot of it is theory. A lot of it said, okay, we started vaccinating for more things at around the same time we're starting to identify more children with autism. And
I mean, it's happening at the same time.
Yeah, it's coincidental. And so, but there's many other factors involved in that. Of all of the medications and of all the things studied, vaccinations are actually studied the most. You know, because of the vaccine compensation law, every child that has a reaction to a vaccine is reported to the CDC, and that case is actually studied, you know, and so, and it's listed, and we know what the we vaccinate millions and millions and millions of children every year, and we know what the side effects and the complications are.
So it's not vaccinate. No way.
No.
So why did it get started? There was a researcher, Eric?
Well, if you think about it, well, there were some studies that had come out in the past that had tried to show some evidence or some links, but basically what you have is just this unfortunate timing of events. And when kids hit about 18 months of age, they're expected to be engaging in their environment and exploring and interacting with their parents and developing some language and doing all these things that they weren't expected to do before. So when you have a child that maybe goes in and gets their well child check, and they ask some questions about development, at the same time they're giving some vaccinations, that that experience for those parents, I think, was really powerful, and it's hard to separate that from each other. And I think that, you know, you could sit some of these parents down and show them stacks and stacks of studies that have been conducted over the years with the rigor that it's hard to find it matched elsewhere, and they will look at you in your eyes and say, my child was not included in that study. And they'll ask you, can those studies tell you if those vaccinations didn't cause it for one child? And they can't, but it's hard to find
any data to support.
There's really no support for that. And
there was one guy who wrote an article in the Lancet and later said, okay, I lied. And it was true, he did lie. And everybody who knows this guy, he did lie. He made this up. And now everybody goes, well, that had...
Well, I think it was a little more complicated than that, but he was trying, one of the things is that the onset of autistic symptoms is around 18 months. We normally give the MMR vaccine, measles, mumps, and rubella vaccine, usually around anywhere between a year and 18 months. We used to give it at 15 months, and then shortly thereafter, that child may develop some symptoms, and so then parents would naturally assume, since they had that vaccine at 15 months, that's what caused it. Andrew Wakefield was he actually is an adult gastroenterologist, and so he was studying older children and adults that had autism, and he felt that many of these children had gastrointestinal problems, and indeed they do. And so he did some studies, took some biopsies, and then cultured some of their intestinal secretions for viruses, and claimed that that he could culture out the measles virus from many of these children years after they got the MMR vaccine. And so, of course, when that was printed in the Lancet, researchers all over the country and all over the place tried to replicate those studies, and nobody could. And so then people went back and they started to question his and many of his people that were on the paper kind of dropped off. They didn't want to be associated with that, and lo and behold, it was discovered later that he was in cahoots with a lawyer who wanted to sue the British government, and so his research was funded that way. So now the Lancet has removed that article from it.
Yes, they have. We have some questions. Well, the first one is about Asperger's. So Asperger's is another story. I mean, we're all familiar with, what was that lawyer show where there was one particular lawyer that obviously was poor in his social tools, but he was brilliant. And so Asperger's was a German psychiatrist, right, who came up with something similar.
Austrian.
Austrian?
Yeah.
Well, tell me about it.
Wow. It seems like most of the people who have done some of the seminal writing on autism were from Austria. I don't know why they.
Is that? Well,
Kanner came from Austria, and Hans Asperger was an Austrian physician, and he described 4 boys that were very, very bright. In fact, one of the boys he described ended up winning a Nobel Prize, and another became a famous astronomer. And so these were very, very bright boys. But and he didn't equate that with autism. He thought he was describing a very different syndrome. And one of the unique things that he described is not only did he describe the uniqueness of the boys that he described, but he also noticed the similarities that these boys had with peculiarities of their parents. And he noticed that this is something that must be genetic because it kind of runs in these families.
and so these kids had these same repetitive things? And the communication inabilities?
Yep, not always language delays, and they're usually kids that are intact cognitively, and they may have good language skills, but their ability to use the language to communicate in social situations is not there. But they also have some of the repetitive or stereotyped behaviors, interests, non-functional routines.
They sometimes have interests like they'll memorize baseball facts, and you can ask them who won the World Series, back in 1924, and they'll know those things.
I know people who know those things. They were med students.
Well, that's one of the criteria to get into medical school now.
Is to be able to remember all those baseball facts. Parenting any child has its challenges, but the parents of a child with autism have additional concerns.
Teenager John McHale loves to jump on his family's trampoline. He soars high and likes to include his brother and sister in the fun.
I wish I could go jump and go outside, go to shopping.
But John hasn't always been able to communicate this well. When he was a toddler, his parents started to see changes in their young son.
We started to notice symptoms that he had stopped talking and wasn't interacting with his brother and sister when he was about 15 or 16 months old.
The McHales tried several options to work on his communication before having a full evaluation through the school system.
The autism team there came up with a diagnosis of this pervasive developmental disorder, which is a form of autism.
The family pulled together and began researching options. Since John had been diagnosed early, they were able to make progress. John's most significant problems lie in the area of speech.
I think it's more processing. I mean, you say something to him, he has to process it before he really understands. And some of it's initiated speech. I mean, he'll sit there and won't say anything unless you stimulate him to say something. You have to get him to say something appropriate.
The early years dealing with autism were the hardest for the McHales.
He required so much attention. He was not able to communicate, and that was extremely frustrating for him. We had some family training and family counseling as far as how to help John the most.
And John is now making strides in his education, thanks to family support and an individualized education plan through the school. Every year, John's strengths and weaknesses are discussed with his parents to decide which classroom situation will fit him best.
History is his strength. He loves to hear about and read a lot of the historical things that have happened and current events he loves.
Where was World War II at?
Germany.
Germany.
And Jean and Mike's advice to parents is to pay attention to the warning signs of autism and seek help early.
get involved with the school system early. I mean, get involved, know what you want, and also think about what they can give you, because you can't get everything you want, but you want to get what's appropriate.
Well, we thank the McHale-has family for laying their heart and soul out there and sharing that story with us so we can learn from it, the value that help is available. We'd love to have your questions, your comments about tonight's topic. Call 1-888-376-6225 or email to questions@oncalltelevision.com. We do have some questions. We should dive into them. Could there be a diagnostic bias toward boys that contributes to the discrepancy between the numbers of cases of each sex? In other words, could it be that we presume that boys have this, girls don't, and therefore that's why we see 4 or 5 or higher numbers of boys per one girl?
I think with autism is a type of disability that's very unique, and for example, I think with ADHD, for example, many times girls present in a different form of ADHD than boys, and so boys tend to be more hyperactive, more impulsive, and they tend to be the squeaky wheel and get picked up, whereas girls tend to be inattentive and have more learning and social problems. So they may look a little bit different. In autism, though, it's pretty. It's such a remarkable disability that you can pick it up, we see girls with it, but boys, it's in a much higher frequency. And it's the same thing with learning disabilities. We see boys have a higher incidence of learning disabilities than girls do, and I don't know why that is. Maybe Eric does.
What's the difference between a boy and a girl?
Yeah.
I've heard that you just look in their genes. You've heard that one.
Yeah,
I'm sorry, that's
really
a bad. That's an old, terrible bad. But let's talk about ADHD too. I have a question what is the difference between ADHD and autism? This person from Aberdeen has a 4th grade son who seems to show symptoms of both. Focusing issues, doesn't look at you in the eye, but also how do you handle this as parents?
Well, one of the things that there's some overlap between ADHD and with autism spectrum disorders is problems with executive functioning.
I hear that all the time. What is executive functioning?
It's a whole range of kind of higher order cognitive processes such as behavioral inhibition, or being able to think through your behaviors before you do things, planning, organization, prioritizing, all of those things that help us kind of get through our day. And along with that kind of comes some impulsivity, distractibility, things that may cause problems in our day-to-day functioning. And so where a lot of times kids with autism, by definition obviously have social problems, kids with ADHD might also exhibit some of the same social difficulties due to the fact that they're not checked in to what's going on around them. They're not picking up on some of the same social cues that other kids would. So they're missing a lot of the same social information, but for very different reasons.
So ADHD kids can really oftentimes do well communicating.
Sure.
And also can have social hunches.
Sure.
I heard one difference between defining a kid with, at least defining an autistic child versus others, is that the autistic child doesn't think that the other person thinks any different than they. And when they put them, they have the story of Janie and Julie with marbles, and Janie puts her marble in her purse, and Julie watches it, and then they both come out of the room, and then they come back in, and Janie, actually Julie comes back in, takes the marble out of the purse and puts it in her own. And then they come back in the room, and they ask the autistic child or the normal child, what does Janie think? Where does Janie think the marble is? Normal kids will say, Janie doesn't know, thinks that the marble is in her own purse. The autistic kid will say, Janie thinks it's in the other purse, because he knows. that it is. You did that? That was too obtuse. I had a hard time explaining that. Could you do a better job?
Well, what it comes down to is just being able to put yourself in somebody else's shoes, take on the perspective of another person. For some kids, just understanding that other people actually do have independent thoughts and feelings and beliefs is a difficult concept. But then to put together that, things that I do and the way that I interact with you has an impact on your behavior and the way that you respond to me, and so they're missing the connection.
They miss that.
So a lot of times they'll come up to somebody and say, you know what, that's a really ugly shirt.
Yeah.
And so somebody will come over and tell them, you're not supposed to tell people that they have, you're not supposed to tell people that. It makes them feel bad. And they'll say, well, but it's true. So but it's true, so I have to tell you about it.
He's telling you you have an ugly shirt.
Oh.
I'm not. But that's kind of the thing where they're not seeing the connection between the interaction with with two people and how that's related. And
many children, and the other thing about autistic kids is that they're kind of indifferent to other people. The other people are not as important as their video game or whatever. And so they don't necessarily care about what other people are doing or thinking or what other people think of them, either. Kids with ADHD, on the other hand, tend to be kind of intrusive. They tend to be in your face, disinhibited, and kind of irritating, more than anything else. And so they both may have social skills problems, but the social skills problems tend to be different.
Is there any way to change the vaccination timing quickly so that people are not fearful of it? Is that something worth doing or worth considering?
Yeah, I would say no. The reason is many of the vaccines that are critically important need to be given early to protect the child. Some of these bacteria cause meningitis, sepsis, serious infections early in life, and sometimes people want to put them off until the kids are 2 years of age, and it's too late by that time, I think.
Tourette's syndrome. What is Tourette's, and is it related to autism?
Tourette's syndrome is actually a neurobehavioral disorder. It's characterized by involuntary movements or involuntary noises. It can be, Tourette's syndrome usually involves complex tics or complex vocal tics. It's often associated with other neurobehavioral problems. Many kids with Tourette's have obsessive-compulsive disorder. They often have ADHD associated with it. Children with autism, interestingly enough, often have tics. We don't usually say they have Tourette's, but they often have tics. And sometimes when they get put on medication for various things, that tics will sometimes present. And I always tell parents that that's really part of their autism. It's a neurologic disorder that goes along with autism.
Well, and do they not also have a compulsive kind of character to them? That movement thing that's just, they can't get out of it? They're a compulsive, obsessive-compulsive.
Sure, they sure can, and it can be the motor movements, but it can also be some of the sensory-seeking types of behaviors. So they may have some kind of a sensory input that is extremely fascinating, or they're just driven to experience flipping wires or playing with the hair, real fine, just rubbing that hair just right between your fingers so that they get that sensation. Can be putting things in their mouth or smelling.
So people who are constantly messing with their hair, is that a clue?
I don't know.
Don't go there.
I better watch it.
The caller knows a child who had constant injury caused by an older brother. They now say he has a mild case of autism. I don't know if it's the older brother or the child. I think it's the child. Is it possible to have autism caused by an outside influence, trauma, the older brother messing?
There are, what I would say is that there are certain infections that, for example, congenital rubella. That's German measles. Yeah. In the old days, women, when they were pregnant, used to get German measles. Their children would be born deaf frequently and often blind, so they'd be both blind and deaf. Many of those children, when they got older, developed all the characteristics of autism. Children that have PKU that are untreated, PKU is a metabolic disorder.
Right.
And
if ketone or
right, very good.
And you don't want to there's certain things that you don't want to eat when you have that, which is?
Protein, yeah. Proteins that contain phenylalanine.
Such as?
Any meats or milk and dairy products. Anything that has a lot of protein almost always has.
And that's the only way, if I have PKU, to prevent it, or is there anything that I can do?
Well, you have to go on a special diet to prevent
the special diet.
To prevent the brain injury that occurs from that.
But I interrupted you. You were on a course.
Well, I was just saying that that's another cause. And then we know that there's genetic disorders that are well described. For example, Fragile X syndrome is many children with Fragile X.
That's a genetic, X syndrome is fragile. I mean, it's a genetic thing.
Disorder, yeah. We see that both in boys and girls, and many of the children with it will have autistic characteristics.
So you think it's possible that the kid answering this story is his brother beating him up a bunch? My sense is the brother is beating him up because this kid didn't have the social sense to interact with his brother, and the brother was frustrated, and that begs the question, do autistic children get bullied more than others? Is that what was happening?
Well, I would look at it the other way around. Sometimes children with autism are very irritating. You know, they can have sometimes a high-pitched cry, or they can make repetitive noises that can just that they repeat the same word or they repeat the same phrase over and over and over again. It can be very irritating, and I could see that happening in the brother getting upset and doing that. But that's not probably what caused the child's autism.
Okay. Let's do therapy now. Let's talk about the treatment. We know we've just touched on it a little bit. What can we do? First, do we do behavioral things, or we go to medicines?
With autism, I think that the only real evidence-based treatment that can help the functioning of the child and help them generate skills that are going to allow them to be more functional are behaviorally based. A lot of these kids, though, have lots of other coexisting conditions, attention problems, anxiety, other behavioral disorders that would maybe require some medications to kind of even out some of those symptoms, but that's not really treating the autism. It's more treating some of the associated signs of autism. So when we talk about addressing those deficit areas of socialization and communication, it comes down to a behavioral approach. So applied behavior analysis, where you're able to look at the child and where they're functioning and figure out where the gaps are, where they're not.
Encourage them in the area where they're having trouble.
Right.
And you can get them there. I mean, can we do that?
But you got to break it down to small, intricate little steps and teach them each step along the way. And that goes for social skills, that goes for communication, that goes for behavioral issues. I mean, you really have to use that approach no matter what your focus is.
When the child's picked up, if you can do intensive therapy on them when they're very young, the goal is to be able to integrate them into normal educational settings so that they can be around a normal peer group and learn a lot of things from their normal peers. They can learn social skills better, they can learn pragmatic language better from normal peers. Sometimes some of these kids, because they have extreme irritability or because they have ADHD, comorbid ADHD, they can't be integrated in a normal classroom. And that's the reason to sometimes put those children on medication, is to be able to get them in a normal classroom so they can be with their normal peers.
Wow, so there is a time for medication, but it's not the primary therapy.
No, it's not the primary.
It just kind of gets to it.
You know, if you think about where this all comes from, you've got a brain basis for what we're seeing in these kids, and that brain basis causes them to interact with their environment in a manner that does not allow typical development. And so you have to stop that cycle and help them interact with their environment in a different way. So we have these little kids, little babies, little preschoolers that are not engaging what we call joint attention. So that's being able to reference a person and follow their gaze to something else and have that kind of social awareness. And so sometimes you need to break it down as basic as getting the child to attend to to another person and then follow their gaze to something else. And that is kind of the foundation for many kids, is their social interaction and their communication is starting with something that basic.
You have to be really good looking to go into autism,
yeah.
right, Derek?
Sexy.
To get their
back to that sexy thing.
to get their attention, to have them look at us.
Yeah. We'll be back right after this.
Chug-a-lug, chug-a-lug, makes you wanna holler, hide-ho. Chug-a-lug, chug-a-lug.
A checkup for colon cancer isn't all that much of a to-do. A simple stool test may be all you need. But even preparing for a colonoscopy is a trifle, considering the odds of getting the second most deadly cancer are 1 in 20. An easy at-home fit test or colonoscopy. Get screened, South Dakota.
Autism is an intriguing neurologic condition diagnosed in childhood, characterized by language delay, impaired social interaction, and decreased empathy skills. Those affected over-focus on objects, not faces, and often express disruptive, repetitive behaviors such as head rolling and body rocking and hand flapping. It's interesting to learn how to help these kids and to see how they grow up. But this topic is especially intriguing because autism brings us to think about the differences between men and women. The word autism comes from the Greek word autos, which means self, and was coined in the early 1900s to describe the self-oriented ways of adults with a certain type of schizophrenia. But in the 1940s and 50s, the meaning of the word changed as psychiatrists began using the term autism to describe a condition in toddlers, often mentally compromised, with symptoms described earlier. At about the same time, a German scientist, Hans Asperger, also described a similar yet milder condition in children whose intelligence appeared normal or high-performing. These children lacked caring and empathizing skills, needed to socialize, and excelled in the ability to focus or concentrate on mechanical systems, objects, and spatial issues. Over time, this condition has become the autism spectrum disorder, which can present mild to severe and which includes other similar but unusual conditions in the group. Of course, we don't know why autism happens, but most believe genetics is the driving force, especially because autism happens mostly in boys. Autism occurs 4 to 15 times more frequently in males than females, and there are theories, correct or not, that autism is a prominent expression of a spectrum of behaviors normally associated with maleness. The following are perhaps unfair and often untrue generalities, but offered for the sake of better understanding autism. Think how little girls like dolls. Females seem more able to empathize, can multitask, easily express feelings, more easily can read another person's feelings, act more gently. In comparison, think how little boys play with wheels and trucks. Males seem less empathetic, more able to concentrate on one task, less able to express feelings verbally. Sometimes are oblivious to the other person's feelings and act out physically. One pop culture book said that women are from Venus, the planet of compassion, and men are from Mars, the planet of war. Some could say autism is from Mars too. Most of us are from both places. But wherever we're from, I think we would do better understanding and celebrating the differences and similarities in people. So I'm throwing at you this whole male deal. We got a minute and a half. Comments about autism being an extreme level of maleness, because there's also the idea that there's an illness in girls that is an extreme lack of sense of self. Everything is empathetic, and everything is wanting to impress. Let's go to the autism spectrum. What do you think? Could it be just a normal hyper expression of maleness?
I would disagree with that. I think you're rather sexist here.
Oh, yeah.
No, I don't. It seems to me, if I had to say one of the neurobehavioral disorders that would be more associated with maleness would be ADHD. That's how I raised 3 boys, and they're busy, very active, in your face, you know. Whereas autism is very different, and I don't think of it as a male or a female feature. I think of it as a very unique feature unto itself. That's what.
Okay. 30 seconds.
You know, I think that there are those in the field that refer to autism as an extreme maleness condition, and it's funny. I think it's entertaining to me. I don't know that there's anything beyond that of substance to me. I think that when we see these kids, male or female, they're exhibiting some of the same symptoms that maybe wouldn't normally be there, and they're not developing other skills that should be there. And so as different and diverse and as heterogeneous as the groups are, I don't think there's anything to the male. No.
Great. Well, this brings us to the end of our show this evening. I sincerely thank our studio guests, Dr. Jerome Blake, a specialist in pediatric development, and Dr. Eric Kurtz, an educator who specializes in autism spectrum disorders, for helping answer all of the wonderful questions from our audience. It was Albert Einstein who taught us, everyone is a genius, but if you judge a fish on its ability to climb a tree, it will live its whole life believing it's stupid. Until next time, stay healthy out there, people.
Funding for On Call is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call, starting its 11th year of opening doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, Regional Health, the Brookings Health System, Dr. Mark Bubak with Dakota Allergy and Asthma, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.